In this class, we'll discuss about one of the disease which is related, or else one of the disease or disorder which is related to immune system, that is bacterial infection called leprosy. This leprosy is one of the chronic granulomatous disease. So what does this mean? So it is an immune system related disorder where the granulomas are the cells of immune system. So in this particular kind of infection, because of the granulomas, they form, if there is any inflammation or injury to the tissue, the granulomas get deposited or they form a cluster at the place of inflammation or injury. So thus they form the granulomas all over the body or all over the skin. So this is a chronic granulomatous disease which is caused by the bacteria called as Mycobacterium leprae. So this is also one of the bacterial infection, and in this leprosy, it mainly involves the damage to especially the peripheral nerves as well as to the skin. In the sense, we can find the lesions or we can find the granulomas over the skin as well as in the peripheral nervous system. Apart from peripheral nervous system and skin, there are various other organs which are also infected, like eye, upper respiratory tract, bones and muscles, ears, as well as testes and mucus of the mouth. So apart from not only peripheral nervous system as well as skin, these are also the parts which are infected by this bacteria. But there are few organs which are not invaded by this bacteria, like CNS nervous system, ovary and lungs. So in the upper respiratory tract, like bronchi, bronchioles, trachea, all these are infected, but the bacteria cannot invade the lungs, ovary as well as the central nervous system. Let us see the etiology of the bacteria. So this is an acid-fast bacteria, or else this is an acid-fast bacilli which is not cultivated in the medium. In the sense, like other bacteria, this cannot be inoculated or this cannot grow in the normal culture medium. So it is only present in some of the host, or else we can say it is only present in some of the carriers, and this bacteria is spread through those carriers only. And this is one of the bacteria which is having a characteristic feature of facultative obligative in nature. So what does this mean? So obligative bacteria are those which utilizes ATP and oxygen for their development or for their cell division. But facultative bacteria are those which may or may not utilize ATP or synthesis. I mean, this bacteria is having both aerobic as well as anaerobic characteristics. In the sense, it can be survived in any kind of media. If there is devoid of oxygen also, this bacteria can replicate, and it is a gram-positive bacteria. Let us see the characteristic features of these bacteria. So this bacteria contains a peptidoglycan backbone. So the main element or as the main structure with which the bacterial cell wall is made up of is of peptidoglycan. So it is having a peptidoglycan structure in its cell wall, as well as this, when we see this size of the bacteria, it is almost 5 microns in size and 0.5 microns in the thickness. So the size of the bacteria is ranging from almost 5 into 0.5 microns. And this bacteria, we can't observe this bacteria in as single, or as we can say that the bacteria is not observed individually. So it is it's always seen in clusters or groups. So that group or cluster of the bacteria is called as globi, and this bacteria is having much affinity towards the Schwann cells as well as the cells in the reticuloendothelium system. In the sense, these cells mostly invade that, they have greater affinity towards that cells when compared to other cells in the body. And this Mycobacterium leprae, it always grows in the cooler regions, even in the body parts also. If it grows in the cooler tissues which is having a warmer skin. In the sense, if the skin temperature is in warm conditions also, but if the tissues are having cooler conditions, this bacteria will survive greater in that situations. And this temperature for which the growth of bacteria is about 30 to 33 degrees. So at this temperature or below that temperature only this bacteria can grow. Above this temperature, the bacteria cannot survive. This bacteria, it's not cultivated in normal media like other bacteria. So, for example, if we take bacteria like Mycobacterium tuberculosis, E. coli, Escherichia coli, and various other staphylococcus species, they can be cultivated on agar medium or various other media. But this bacteria, it cannot grow in the media, but it is only present in the carriers, or it is developed in the carriers like nude mouse. So in the nude mouse, this bacteria can be observed, as well as in the 9-banded armadillos. So in these species, mostly this bacteria can grow. Apart from that, it can also be observed, or else we can say the reservoirs of these infectious bacteria is like, first thing is humans. So if a person is having leprosy, or a lepromatic person is more prone as a reservoir when compared to non-lepromatic person. So if a person is suffering with leprosy, we can say he's a reservoir, like he's a mobile reservoir for spreading the bacteria. And there are various other reservoirs like 9-banded armadillos. They can very easily, or else we can say they are mostly grown in this species, chimpanzees and manga bay monkeys and sphagnum moss. So these are the reservoirs of this bacteria. How this bacteria is spread, or else we can say the portal of exit for this bacteria is that first thing is through nasal mucosa. If a person sneezes, then in that sneeze droplets, then this bacteria can come out of the infected person and it may invade the healthy person. And apart from that, it can also be spread, or else we can say it can also come out of the infected person's body through the bruises or cuts. If there is any ulcer, or if there is any injury or a damage or bruise to the skin of an infected person, through that damage also the bacteria can come out into the air. Let us see the transmission, how this bacteria is getting transmitted. So one thing, it is getting transmitted from person to person either through nasal or oral droplets. So if an infected person is there, if he sneeze or cough, then the droplets which are coming out of his body contain millions of bacteria. So this bacteria, if a healthy person is standing in front of infected person, if he breathes the air which is exhaled out of the infected person, then definitely the healthy person can be prone to this bacteria. And dermal inoculation. So if we give the injections which is given to infected person and the same injection is used for the healthy person, then the bacteria will be spread very easily. Not only this, mainly these are the two major mode of transmission. Apart from that, even the direct contact with the skin. If an infected person, if we have the direct contact of the skin of the infected person, then also the bacteria will spread. And if we come in contact with the soils or fomites, for example, infected person, if a bacteria, or else in the soil the bacteria is present, and if we touch that bacteria, or else if we step into that soil also, then definitely the bacteria will enter into the body, because it will stick to our body and it can easily enter through the dermis of the skin. And the other routes where the infection is spread is through insect vectors. So these mosquitoes and bed bugs, so these act like vectors. They bite the infected person and the bacteria will enter into the mosquito or bed bugs, and if the mosquito which is carrying the bacteria, if it bites the healthy person, then it definitely leaves the bacteria into the healthy person. And not only that, tattooing needles. So if an infected person is having tattoo and if the same needle is used for the healthy person, then also the transmission will take place. Let us see the incubation period of bacteria. So what is the incubation period? So this incubation period is nothing but the time, or else the time between the exposure of the bacteria to the first sign of the symptom. So the time gap, or else the time period present between the invaded, for example, bacteria has entered into a person, and the time from the entry to the sign, or else the sign or symptoms where the person is showing. So the time period which is there, that's called as incubation period. So in this incubation period, the bacteria will replicate and it spreads all over the body, and then it shows the sign and symptoms in the person. So the incubation period will be ranging from about 2 to 40 years or more. So on an average, we can say the incubation period of this bacteria is almost for 3 to 5 years. So that is the reason it's very difficult to recognize whether the person is suffering with this bacteria or not. So if the person is if the bacteria is entering into the body, after 3 to 5 days it's showing its symptoms, then in the meantime the bacteria will replicate heavily and it will spread all over the body. So we can't identify the bacteria until the incubation period. The generation time, so generation time is nothing but the development of the next generation. The time gap between the existing as well as the development of next generation is called generation time, and it's almost 12 days. Then the infectivity. So this leprosy, it is highly infectious disease, in the sense it can spread very easily, but the pathogenicity, or else we can say the pathogenesis of the bacteria, is very low. Let us see the factors which are influencing the transmission. So one thing is that virulence factor. So what is virulence? Virulence is nothing but the damage, or else the extent or the capacity of damage which is caused to the tissue by the bacteria. So bacteria is invading the tissue, and how much extent the bacteria can damage the tissue, that is called virulence factor. If the bacteria is highly virulent, then the transmission is high. So the virulence factor of the bacteria depends upon how extent of transmission and extent of the disease, and the host factors. So the body conditions of the person also determines the extent of transmission. If he is weakly immune, or as we can say if a person is having a weak immune system, he is more prone to this bacterial infection. Environmental conditions, so we have to maintain hygienic environmental conditions. If not, the bacterial infections are mostly observed. And social factors. Leprosy is classified as various because we can observe the lesions, or we can observe the granulomas on the skin of the person. So based on this, the leprosy has categorized as lepromatous leprosy, tuberculoid leprosy, borderline lepromatous leprosy, borderline tuberculoid leprosy, as well as indeterminate leprosy. So these are the types of leprosies. Apart from that, the WHO, World Health Organization, has given another classification for the division of this leprosy. That is, it is given as two: paucibacillary leprosy as well as multibacillary leprosy. So paucibacillary leprosy is nothing but it is non-infectious type of disease. It's not that much infective. And whereas multibacillary leprosy is a kind of leprosy which is highly infectious. So in paucibacillary, we can see the tuberculoid leprosy as well as borderline tuberculoid leprosy. So tuberculoid leprosy as well as borderline tuberculoid, these two come under the paucibacillary leprosy type. In this, what we can observe is that the lesions which are present on the skin. So this classification is made based on the infectious capacity of the bacteria. That is, the skin lesions which are observed. So in this paucibacillary type of leprosy, we can see the skin lesions up to 2 to 5 skin lesions can be observed. But if we see in multibacillary leprosy, that includes lepromatous leprosy and borderline leprosy, where the lesions are more than 6. If a person is having skin lesions greater than 6, we can count the lesions. So based on that count, the classification is made. Let us see the types of leprosy. So first type is indeterminate leprosy. So indeterminate leprosy is the initial stage or first stage of the lepromatic condition. So here we can see in this condition 1 or 2 vague hypopigmented macules are observed. In the sense it is initial stage. So we can see only 1 or 2 hyperpigmentation conditions on the skin. So very few lesions are observed, and these lesions, if they are untreated, then what happens is that they spread all over the body, and it may lead to the second stage, that is tuberculoid leprosy or lepromatous leprosy. And this indeterminate leprosy is negative to bacteria, in the sense it may show the test, if we perform the test, that may be negative to bacteria. So here this is the pictorial representation of this indeterminate leprosy. The lesions are few. We can observe 1 or 2 lesions. The other type of leprosy is lepromatous leprosy. So lepromatous leprosy contains numerous macules. In the sense, if a person is suffering with lepromatous leprosy, there will be many lesions or else many granulomas on the skin, and there will be plaques also which are observed on the skin. And apart from that, not only plaques and skin lesions, we can see the bluster, we can see the bubbles, or we can see the blisters or nodules we can see because of the cluster of granulomas which are accumulating at the inflammatory site. We can see the nodules in this kind of lepromatous leprosy, and the skin which is there, the skin will be at the granulomas or at the nodule site, the skin will be shiny as well as it will be smooth. This lesions will not be hard. At that particular site, the skin will be smooth. Here, if we see the sensation or else the sensing capacity at that particular nodules in this person is normal, in the sense they may feel sensitivity or they may not. Sometimes they may feel the sense and sometimes they may not. Whereas SS, that is sputum smears for this acid-fast bacilli. SS is nothing but sputum smears. AFB is nothing but acid-fast bacilli. If we observe the sputum smears in lepromatous leprotic condition, then the acid-fast, the bacilli which is present in the sputum of this lepromatous leprosy infected person is many. We can see many bacteria in that particular microscopic slide. And the lepromin is one of the tests which is performed as the diagnosis of leprosy. So in this lepromatous leprosy, this lepromin test can be negative. The other type of leprosy is tuberculoid leprosy. So what is this tuberculoid leprosy? Here we can see the lesions which are observed on the skin may range from 1 to many. So 1 to many in the sense the skin lesions. For example, let us take an example like if the person initially has 1 lesion and later it may develop up to 10. So the lesions may range from single to few, and they will have asymmetrically distributed on this trunks and limb. So in the trunk as well as limb region, the lesion spreading will be we can say the lesion spread will be asymmetrically, in the sense the lesion size of the lesion is not equal. If we see the indeterminate as well as lepromatous leprosy, the lesions are symmetrically made, or else the lesions which we observe are symmetrical. In the sense, if we observe them on medial plane, then the lesions will look same. But here the lesions which are developed are asymmetrical in nature, and they are having this dry, flat as well as raised erythromatous or pigmentations. So here whatever the lesions formed, they will be of hypopigmented. This hypopigmentation we can observe at the place of lesions, as well as these lesions are dry as well as flat, in the sense in like lepromatous, here nodules are not observed. The lesions which are formed are flat. And because of the skin lesions which are present, then the nerves which are damaged are very few. And the sputum smears which are observed for this acid-fast bacteria is negative, in the sense if we observe sputum for this tuberculoid leprosy person also, we cannot observe in the sputum. And the lepromin test is strongly positive for this kind of leprosy. So here these are the lesions which are observed on the skin as well as on the neck as well as on the hand. The other type of leprosy is borderline lepromatous. So borderline lepromatous is nothing but this is a lepromatic leprosy condition where the numerous skin lesions are present. Many skin lesions are observed on the skin, and these contains whatever the skin lesions which are developed, they are of nodules. Because this is a condition of both leprosy as well as borderline. Here in this, the lepromatous leprosy condition is there, but the numerous nodules are present. Here the nerves may be symmetrically or asymmetrically enlarged. So the nerves which are there, as this invades mainly the peripheral nervous system, the nerves which are there, the nerves develop, or else we can say the nerves which are enlarged, either they may enlarge symmetrically, in the sense they may enlarge both sides equally, or else they may enlarge asymmetrically also. And the sensation which is there in borderline lepromatous leprosy, the person may feel senses, or else she or she may feel sense, or he may not. And the sputum smears are, if we observe the sputum smears, even in this condition also, the acid-fast bacteria are in numerous, we can observe many bacteria in that particular specimen. and the lepromin test is negative. In lepromatous, any kind of lepromatous leprosy, the lepromin test is negative, and in the sputum smear we can see numerous bacteria. Whereas if we see the tuberculoid type of leprosy, here the sputum test is positive, but the smears won't show bacteria. This borderline tuberculoid, here also it is a combination of tuberculoid and borderline, where the smears or skin lesions are flat but various skin lesions are present. Many skin lesions are present, and here the nerve enlargement is symmetrically symmetrically made, and here we can see the pigmentation which is observed in the skin lesions is hypopigmentation. The sensation, so sensation which is observed in the person is like the person may not feel senses at all, that is hyposthesia. This is a condition where the person cannot feel even the sense at that particular space. If we prick or pinch at the lesions of the skin, at the site of lesions on the skin, then the person may not feel any pain. So he is lost senses at that localized area. And the smears which may observe, these smears may contain bacteria or may not. So depending upon the severity of the condition, this bacteria can be observed in the sputum smears, and the lepromin test is weakly positive in this condition. Let us see the diagnosis of leprosy. So what is how can we examine? So clinical examination, first thing is that we have to observe the person physically. So if we observe the person physically, if we look at the skin only, we can make, because the leprosy is a condition we can see where the skin lesions are formed on the skin. So that is the reason, by observing the lesions only we can say which kind of leprosy the person is suffering from. But if we cannot make through that, then other tests are performed. And in this, while we observe the person physically, we have to make sure the palpitation, in the sense the nerve pulse, whether the pulse is normal or is there any abnormality in the heartbeat of the person should be observed. And we also have to test for the sensation, whether the person can feel the senses or not. The other one is bacteriological examination. So here we have to either collect the sputum or the skin smears as well as the nasal smears. So sputum as well as the nasal mucosa. We have to collect the nasal mucosa sample, as well as we have to take a skin sample, and we have to perform the test, and we have to observe under the microscope. Bacterial index. So after this test is performed, after the bacteriological test, we have to take the sample, and when we observe under the microscope, bacteriological index is the main factor which is observed. So what is this bacteriological index? It is the range of bacteria. So mainly if we see the Ridley logarithmic scale, so this is a scale based on which the range of bacteria is given. So that is B0. B0 in the sense the microscopic sample is devoid of bacillus, in the sense no bacilli is present in the microscopic sample. So if it may range from, this scale may range from 0 to 6 plus. So if the bacteria is if the scale is showing greater than 6, then the severity of the disease is very high. So if it is showing between 0 to 6, then the severity of the disease is medium, and if it is 0, then the person is like, we can say, we cannot observe the bacteria on the skin in the microscopic sample. Let us see the morphological index. So after we observe the bacteriological index, we have to see the morphological index. We have to see the morphology of the bacteria. So there will be a stain. We have to stain the sample, and then we have to observe under the microscope, and we have to see the morphology or the structure of the bacteria which are observed under the stain. So this determines the solid fragmented granular percentage. So what does this mean? Solid fragmented granular percentage. So this is one of the morphological index which is observed in the bacteria. So once if we see the percentage, then we can report how much extent the person is suffering with the bacterial infection. The other one is foot pad culture. So foot pad culture is one of the diagnostic tests which is performed specially to identify this Mycobacterium leprae. So what does this mean? So it is, we can say, this test is 10 times more sensitive in detecting the bacillus bacteria. So when compared to other tests, we can detect in this particular test, the susceptibility or the sensitivity of this test is 10 times greater in identifying the bacilli type of bacteria. So that is the reason this test is performed mainly to observe the Mycobacterium leprae species. But here the time period, the main disadvantage of this test is that the time period. So the time period, it is very time consuming, and it requires almost 6 to 9 months to show the result. What is this test? What is this test used for? So this test is mainly used to detect the drug resistance. So if a person is having resistance to any drug treatment or not. So this test is mainly used to observe that, and apart from that, we can evaluate the potency of the anti-lepromatic drugs. So if we are giving the treatment for leprosy to a particular person, by performing this test, we can say that whether how much efficient or how much potent the drugs are which are used in the treatment. The other test is histamine test. So histamine is one of the chemical mediator which is released in the body. So histamine test is performed in order to diagnose leprosy in this way. First, we have to take 0.1 ml of the injected preparation, or else we can say the 0.1 ml of the prepared preparation. Here we have to dilute the histamine phosphate in the ratio of 1:1000. So if we take 1 molecule of histamine phosphate, then 1000 molecules of water, we have to dilute it in the ratio of 1:1000. And then after the solution is prepared, then out of that 0.1 ml of solution is taken and it is injected at the hypopigmented area of the skin lesion. So because of that, if we inject histamine at that particular place, we can observe a response called as triple response. So what does this triple response mean? If we inject histamine at that particular place, then histamine in general, it causes rashes in the body. So the extent of rashes which are observed at this particular area, because histamine can worsen the condition of leprosy. So in that condition, we can perform how much extent the person, or how much extent or else what type of leprosy the person is suffering from. Biopsy. So biopsy is another test which is performed in the diagnosis of leprosy. Biopsy is nothing but we have to take out one tissue out of the body or injured tissue. If for example, let us take the skin. So skin is the tissue which is injured in leprosy. So we have to take a part of the skin and we have to observe it under the microscope in order to see the extent of diseased condition. The other tests which are performed are immunological test. So immunological test, in this bacterial, any bacterial infection, the immune system is the main system which is invaded. So that is the reason we have to perform immunological test, like test for cell mediated immunity, that is lepromin test. So what does this lepromin test? We saw that different types of leprosy, they are negative to lepromin test, strongly positive to lepromin test. So what is this lepromin test here? In the lepromin test, we will take a sample of inactivated bacteria. So the bacteria which is not causing any we can say any infection in the body. So we are taking such a bacterial sample and we are injecting, especially at the region, at the hand region, mostly we take hand region, and we inject that bacterial sample to the person, and then there we can observe a pumping out of the skin, or else we can say a bulging of the skin at that particular area. So what does this mean, or what does this show? In this test, we are showing, or else we are representing the immunity capacity of that person. If the person is strongly immune, then the immediate reaction is observed. If this person is weakly immune, then the immune system is not recognizing the antigen which is entering into the body. So this bacteria is antigen. So if any antigen which is entering into the body, our immune system will generate antibodies to invade that antigen. So here the pumping out represents that the antigen is detected by the immune system. So if a person is weakly immune, then the pumping out cannot be observed. So based on that, we can see whether the person is very highly immune or not. And the other test is FLA-ABS test. That is, fluorescent absorption antibody test. So what does this mean? Here if we take or else if we expose the infected area to fluorescent or light, then we can observe some sort of different fluorescence. So this fluorescence is based on the frequency as well as the velocity of the bacteria. So based on the fluorescence also we can say which type of leprosy the person is suffering from. And the other one is monoclonal antibodies as well as RIA and ELISA, that is radio immunoassay and enzyme linked immunosorbent assay. So these are the tests or immunological tests which are performed in order to diagnose the leprosy. Let us see the drug treatment. So what is the pharmacological treatment or pharmacological approach in the treatment of leprosy? So there are various drugs used like sulfones, phenazine derivatives, anti-tubercular drugs and antimicrobial drugs. So these are the drugs which are used in the treatment of leprosy. So sulfones include drugs like dapsone and phenazine derivatives include clofazimide, anti-tubercular drugs include rifampin and ethionamide, and antimicrobial drugs include ofloxacin, moxifloxacin, clarithromycin as well as minocycline. So these are the drugs which are used in the treatment of leprosy. Let us see the individual drugs. So the first drug, or else we can see the first line of drug which is used in leprosy treatment is dapsone. So dapsone, the main mechanism of action of this dapsone is that it inhibits the bacterial folate synthesis. So folic acid is one of the main ingredient in the cell wall synthesis or DNA synthesis of the cell. So if we inhibit the folate synthesis in the bacteria, then definitely the replication of the bacteria can be inhibited, whereby the bacteria cannot spread. So this is how the dapsone is acting. And if you see the structure of the dapsone, it is containing a sulfur group with two double bond oxygens, and this is bacteriostatic in nature. Because of the sulfhydryl group which is present in the dapsone, this is the main characteristic feature where it is showing the effect. Let us see the pharmacokinetics. So this dapsone is mainly given through oral route and it is well absorbed in the GIT and it is well distributed also. So when the absorption capacity is more, then the distribution will be more also for that particular drug. And this produces 10 times more concentration in the diseased person than the normal person. In the sense, if we give this dapsone to the normal person, that it shows less effect when compared to the infected person. So if an infected person is given dapsone, then it will show greater potency. This infected and normal skin is nothing but the development of lesions. If the lesions are in the initial stages, then this dapsone may not show that much effect when compared to the severe conditions of leprosy. And the T-half of this drug is almost 24 to 48 hours. The dose of the drug which is recommended is 100 mg per day. Let us see the adverse effects of this dapsone. So if dapsone is when given in higher doses, it may show adverse effects like hemolysis of red blood cells. So there occurs the breakage of the red blood cells leading to anemic conditions and methemoglobinemia, anorexia, nausea and vomiting, fever, allergic conditions, neuropathy and lepra reaction. So there will be various allergic reactions also observed. But this dapsone should be contraindicated in anemic conditions. So if a person is having anemia and if we give dapsone, because of the overdose, it may lead to more hemolysis of RBCs where it severes the condition of anemia. The other drug is clofazimide. This is a phenazine derivative drug and this drug is a phenazine dye. It is dye. We can say the nature of this drug is dye. It produces some coloration and it interferes with the template function of the DNA. So in the formation of DNA, there are two templates used. So one template and the other template, if the templates join together, then only the DNA synthesis will occur. So this in the DNA formation, it inhibits or else it interferes with the template functioning, thereby the DNA synthesis or DNA functioning may not be proper in the bacterial cell, and it even has anti-inflammatory activity also. So in leprosy we can see inflammation also. So if this clofazimide is given, it may even reduce the inflammatory reactions also in the body. And the T-half of this drug is almost 70 days. It is having a high T-half. And that is the reason the dose of this drug should be monitored. And this clofazimide, we can say it is very useful in the patients who may not show or else who may not show proper effect for dapsone. So if we are giving dapsone, so even this bacteria is also tolerant. It shows resistance towards the drugs if we give individually. So that is the reason if dapsone fails to show its effects, then clofazimine is very useful in that case. Let us see the adverse effects of this clofazimine. So clofazimine will have common side effects like headache, dizziness, dose-related nausea. If this is given in low dose, then the person may not have any discomfort. But if the dose is exceeded than normal, then the person will have nausea sensation and then gastrointestinal disturbances as well as red, brown to black skin discoloration. Even the coloration of the skin may differ because of the side effect of this clofazimine. The other drug is rifampin. So rifampin is an anti-tuberculoid drug. So it is used as a first-line drug in the treatment of tuberculosis. So how this rifampin is used in the treatment of leprosy? So it is a bactericidal drug. As this drug inhibits the cell wall synthesis, not only it inhibits the Mycobacterium tuberculosis cell wall synthesis, but even it breaks down, or else we can say it inhibits the cell wall synthesis of Mycobacterium leprae. So that is the reason it is showing bactericidal effects. And the multi-drug, or it is used in the multi-drug treatment at the dose of 600 mg. So if in multi-drug treatment, if we are giving the treatment with more than 2 drugs, then this rifampin is given at the dose of 600 mg, and it is given for almost a month. And this rifampin, because of its bactericidal effects, it may give relief with the nasal symptoms or else skin lesion symptoms. So it may give relief with the pain or discomfort which is caused because of the skin lesions. Let us see the adverse effects of rifampin. So this rifampin has common adverse effects like breathlessness, shock and collapse. So it is, if rifampin is given in overdose, it may show the side effects to the respiratory system, like there will be difficulty in breathing of that person, and sometimes it may lead to shock and collapsing of the respiratory system also. And the urine as well as the secretions of this urinary system, the secretions may be observed in red coloration. And apart from that, there will be cutaneous syndrome. Cutaneous syndrome in the sense there will be flare, flushing as well as rashes because of the overdose of rifampin. It may also show flu-like syndromes. So in excessive dose, it may cause pneumonia or flu-like syndromes, and there will be abdominal disturbances or GIT disturbances. That is the reason it should be contraindicated in hepatic and renal dysfunctions. If a person is already suffering from renal disorders and if we give rifampin, then definitely it will worsen the situation. The other drug is ethionamide. So ethionamide is also an anti-tuberculoid agent which is used in the treatment of tuberculosis, and this is a compound called ethyl isothionicotinamide. So it is having a structure of ethyl isothionicotinamide. We can also say that chemically it is isoniazid. It represents the structure of isoniazid, and it acts synergistically with dapsone. In the sense, if this drug is given in combination with dapsone, then it shows synergistic effect, or else we can say this combination is very effective in the treatment of leprosy. And the dose of this ethionamide is almost 250 mg per day. The other drugs are fluoroquinones. So the fluoroquinones, for example, the drugs which come under this category are ofloxacin, moxifloxacin, sparfloxacin. So these are the drugs, and these are very effective drugs under this category, and these are bactericidal in nature. Again, these fluoroquinones are the drugs which inhibit the cell wall synthesis. If the cell wall synthesis is inhibited, then the development or the spread of bacteria or cell division can be inhibited. And this drug is, we can say that these are the drugs which are used as an alternative drug. If dapsone or else if the anti-tuberculoid drugs, they show resistance, then this is used as an alternative drug in the treatment of leprosy. The other drug is minocycline. So minocycline is the another drug which is used for the treatment of leprosy, and this is a lipid soluble tetracycline. So this minocycline is lipidic in nature, and it is having a tetracycline structure, and this penetrates the Mycobacterium leprae. So if this minocycline, when it is given into the body, or else if it is given to the infected person, what does it do? It go and directly it enters into the Mycobacterium leprae cell itself. And when if it is invading the bacterial cell, then definitely it will destroy the bacterial cell, thereby leading to thereby preventing the spread of infection. And the dose of this minocycline is almost 100 mg per day. Based on the T half as well as its plasma half-life, the dose may be increased. And the adverse effects of this drug is vertigo. The other drug is clarithromycin. So clarithromycin is an O-methyl derivative of erythromycin. So in the erythromycin structure, if we make some changes or addition of the oxygen molecule which is attached with the methyl group, then this clarithromycin is formed. And the dose of this clarithromycin is almost 500 mg daily. It requires a dose of 500 mg daily, and it is also bactericidal in action. It almost kills 99.9% of the germs. Let us see the pharmacokinetics of these fluoroquinolines. So these fluoroquinolines are metabolized in the liver with the help of the cytochrome enzymes which are present in the liver, and they are converted to 4-A-hydroxyclarithromycin. So once it is entering into the body, it undergoes metabolism in the liver and it is converted to 14-hydroxyclarithromycin. So in the 14th position, the hydroxyl group is attached and it is converted to the metabolized form. And once it is converted to the metabolite form, it is excreted through the urine. And this drug should be given with a particular dose in kidney-related disorder. So the adverse effects may worsen the kidney condition. So in that particular case, the dose adjustment should be given. Let us see the resistance of these drugs for bacteria. So how we saw that these anti-lepromatic drugs show resistance towards the bacteria. So what is the capacity of resistance? If we take rifampicin or rifampicin, which is an anti-tuberculoid drug, it is the DNA-dependent RNA polymerase beta subunit. So it is DNA-dependent in the sense it functions as like it is used in the conversion of DNA to RNA. So for the RNA synthesis, the DNA is required. So if this is the function, in this particular case, then the drug will be highly tolerant. In the sense, the bacteria, when it changes its structure, then the DNA structure will also change, whereby the drug will show more resistance in that condition. The other drug is DDS, which is nothing but dapsone. It is used in the dihydropteroid synthesis. And ofloxacin, which is used in the functioning of DNA gyrase. In all these cases, all drugs show highly resistance. In instances, these drugs are highly resistant. When the bacteria changes its structure, then automatically these drugs will fail to function. So that is the reason multi-drug treatment should be given. These drugs always should be given in combination in order to show effect, because each and every drug has its own mechanism of action. So if we give in combination of the drugs, if one drug fails to show if one drug, for example, let us take the example of dapsone and rifampin. So dapsone, it is used to inhibit the cell wall synthesis. Whereas if we take other drugs which are inhibiting the protein synthesis, like clarithromycin or azithromycin, in this case, if the dapsone fails to show its effect, then the clarithromycin or azithromycin will show its effects by another mechanism of action. So here the WHO has introduced the multi-drug treatment for this leprosy in the year almost 1981, and this is implemented in NLEP, that is National Lepromatous Eradication Committee or Eradication Program, where this multi-drug treatment policy has been implemented. What are the main goals of this? Why does this multi-drug treatment is given in leprosy? The main goals are to prevent an emergence of dapsone resistance. So if dapsone is the mainly used drug in the leprosy, if it shows resistance, then this multi-drug treatment is preferred, and it is used to reduce the duration of therapy. As if we give the individual drug, it may take for longer period of time. If we give the combination of drugs, then the effect will be more, and thereby the duration of therapy can be reduced. And it is also used to eliminate dormant forms. So this mycobacterium species are dormant for longer period of time. So in this condition, in order to eliminate these dormant forms also, the multi-drug treatment is very useful. Let us see the regimens, or else what are the multi-drug regimens which are recommended by WHO, because WHO has categorized the leprosy into paucibacillary as well as multibacillary. So what are the multi-drug regimens which are recommended by WHO? So in paucibacillary leprosy, the drugs which are recommended are dapsone and rifampicin. So dapsone and rifampicin are given in combination. So here dapsone is given at the dose of 100 mg daily, with rifampicin at the dose of 600 mg once a month. So the dose of rifampicin should be monitored. It should be given under supervision only. And the duration of this therapy is for almost 6 months. If we take multibacillary leprosy, here dapsone and clofamizine are given along with rifampicin and clofazimine. So dapsone at the dose of 100 mg in combination with clofazimine with 50 mg are given, whereas the combination of rifampicin at 600 mg plus clofazimine 300 mg once a month is recommended. So these are the ideal dosage regimens in the treatment of leprosy, and the duration of therapy of this multibacillary treatment is almost for 12 months.